So there's a feeling you could actually feel when your hip actually has a problem, right? So when you are walking, maybe you are hearing some funny sounds. Alright, so they call that a clicking sound, or they call that a clunking sound. Alright, when you move with your hip, okay, to a particular, position and all of that. So a lot of things could actually cause your hip to be producing those funny sounds. You understand? So we'll talk about each of those things that could actually make your feet to actually start behaving this funny. So clicking or clunking sounds during hip movement is often linked to a condition known as snapping hip syndrome, or they call it Coxa Saltans. Do you understand? So I actually put the basic word there. This is because most of the times you hear medical professionals talking about a snapping hip, right? They don't actually talk about this basic stuff, So it's also known as Coxa Saltans. It's common in people that dance, athletes, or you have used your hip for a very long time, extensively. You understand? So it can affect anyone though. Okay, so for the types, you have the external one, which is the iliotibial band snapping over the greater trochanter of the femur. Have the inner one, okay, which is the iliopsoas tendon sliding over the pelvic bone of femoral head. The intra-articular, this one is all those ligaments and tissues actually found in the joint. They are the ones making the noise. So if somebody is having this issue, you should watch out for when they become so audible. Audible clicking, snapping, or clunking during movement, sensation of hip catching or giving way, pain or tenderness. If you try to touch the place, the person is screaming and all of that. The person is having a lot of discomfort when they lie on that side that is affected. Okay, so diagnosis and evaluation is physical examination, where you are trying to move the hip. So if you are moving the hip, okay, different range of movements and all of that, the patient might be complaining. Patient might be complaining. Then imagings. This is where you want to now do all those imagings, okay, to look at the inside, to see which joint is affected, to look at which tendon is affected, to look at which ligament is affected. So differential diagnosis: when you see somebody having a clicking or clunking sound when they walk with their hip, it could mean several things. Do you understand? So some of these things include that it could be that the bursa on the hip is becoming inflamed. It could be that they have the hip joint is dislocated. All right. Sometimes it could be that the tendons around that place are becoming inflamed and all of that. So treatment, physical therapies, because you just want to make that place to continue with the least motion it can do. Do you understand? Because if you just feel like, okay, I have pain here, let me just leave this part of the body to just be, it might lead to greater complications. Stretching, using anti-inflammatory drugs. All right, and sometimes if you have tears around that place, you might actually want to do surgeries to correct it.